Hello, my name is Andrew Newquist, and this is my video response to Elizabeth Kerns on our bundle payment video for our Assessments of Outcome class over at Florida Poly. Basically, the background on that video was that our fee-for-service system currently is driving up cost of healthcare, making us spend 18% of our GDP per year on healthcare alone, and how we tried to use bundled care payments to correct that. And the bundled care payment would essentially be, if you go in with a certain issue, you pay a designated cost, and that cost covers all care done from when you get admitted to 30 days after readmission. Unfortunately, it works, but you have to rework the entire system for it to be viable at every hospital level, at every healthcare organization level. Why I would like to see this system work, and I think that we could do something such as the way that lawmakers essentially demanded or incentivized that we all switch to EHR systems. We might or should do something like that, because we've seen over the past 30 years that when bundle care payments are implemented, they do work. It's just the actual fact of getting it to where they can work, reworking that system. But if we can't use that system, I think that we should use ACOs, or accountable care organizations. This is a system that will slightly modify the fee-for-service model. It financially rewards providers who come in under a yearly benchmark spending goal and adhere to quality standards. So you would work with a group of healthcare organizations to get your care at a certain benchmark, and when that happens, you can be reimbursed or paid in another way. This is a system that works under the assumption that bringing healthcare organizations together is a good thing, and in the long run bring costs down. Because say that you have breast cancer, you have to go to a women's center, you got to get scans done, then you got to go back to another center, get scans done there, and sometimes those healthcare organizations won't trust the other person's scans, reorder the same scans again. Where in a accountable healthcare organization, they all trust each other, they're willing to use each other's data, and just one scan can be done, saving you the cost of two or three scans or 2 or 3 tests. And one of the big things, it's all about general health as well. So many of these organizations that have applied an ACO system, they try to essentially better your health overall, like community care. So one of the healthcare organizations, OSF Health up north, they give everybody a care manager. That care manager will essentially be there to answer questions, have input on what the patient should do even when they're not in the hospital. So this is like a lifetime thing. And while they are in the hospital or are in a health organization, they can help guide where they should go next. All of this will be overseen by the main physician, so he can track everything, but that care organizer can organize and help that person understand what's going on, where do they need to go, how do they get this injury fixed. So even if they're going to a specialist, a mid-level care provider, or a primary care physician, they all know it's been done because of this organized healthcare, and they can utilize that to not reorder tests. And the way that this brings costs down is that by everyone working together, it's going to promote integration of care, which is better in the long run, because you're not going to just whoever your insurance provides, you're going to essentially a team of every healthcare professional that you need to see for whatever care you need. So this will end a fragmentation of healthcare where they won't know what the other companies did. There will also be a monthly or annual payment instead of a fee-for-service payment. So there's not an incentive to run more tests other than what's needed, because it's going to be based off your quality at the end. And if the quality of health goes up, you'll get paid, and nobody will be penalized. And also, it'll streamline the service with these penalties, because as time goes on, we'll see what works for other patients, and you'll be able to just implement a certain best practices of, hey, for the last 500 patients that had this issue, they did these things and this works. So it leads into big data that way. And finally, at the end, my sources were 2 videos on ACOs, one from UFO Health, and the other one from Toshiba Medical. I found a lot of information on the CMS website where they talked about their pilot program for this and where it was implemented. Also, a lot of articles from The Atlantic, AmericanProgress.org, and Brookings.edu.